Tolcapone is a catechol-O-methyltransferase (COMT) inhibitor used as adjunct therapy in the symptomatic management of idiopathic Parkinson's disease. In this video, let's found. What is Tolcapone? What is Tolcapone used for? Contraindication. What are the side effects of taking Tolcapone? How does Tolcapone work? How to use Tolcapone? What is Tolcapone? Tolcapone, sold under the brand name Tasmar, is a medication used to treat Parkinson's disease. It is a selective, potent and reversible nitrocatechol type inhibitor of the enzyme catechol-O-methyltransferase. What is Tolcapone used for? Used as an adjunct to levodopa/carbidopa therapy for the symptomatic treatment of Parkinson's disease. This drug is generally reserved for patients with Parkinsonian syndrome receiving levodopa/carbidopa who are experiencing symptom fluctuations and are not responding adequately to or are not candidates for other adjunctive therapies. Contraindication. Combining Tolcapone with non-selective monoamine oxidase inhibitors such as phenelzine or tranylcypromine is contraindicated. Tolcapone is also contraindicated for people with liver diseases or increased liver enzymes. What is Tolcapone used for? Used as an adjunct to levodopa/carbidopa therapy for the symptomatic treatment of Parkinson's disease. This drug is generally reserved for patients with Parkinsonian syndrome receiving levodopa/carbidopa who are experiencing symptom fluctuations and are not responding adequately to or are not candidates for other adjunctive therapies. Pharmacodynamic. Tolcapone is a potent, selective, and reversible inhibitor of catechol-O-methyltransferase, COMT. In humans, COMT is distributed throughout various organs. COMT catalyzes the transfer of the methyl group of S-adenosyl L-methionine to the phenolic group of substrates that contain a catechol structure. Physiological substrates of COMT include dopa, catecholamines, dopamine, norepinephrine, epinephrine, and their hydroxylated metabolites. The function of COMT is the elimination of biologically active catechols and some other hydroxylated metabolites. COMT is responsible for the elimination of biologically active catechols and some other hydroxylated metabolites. In the presence of a decarboxylase inhibitor, COMT becomes the major metabolizing enzyme for levodopa, catalyzing it to 3-methoxy-4-hydroxy-L-phenylalanine, 3-OMD in the brain and periphery. When Tolcapone is given in conjunction with levodopa and an aromatic amino acid decarboxylase inhibitor, such as carbidopa, plasma levels of levodopa are more sustained than after administration of levodopa and an aromatic amino acid decarboxylase inhibitor alone. It is believed that these plasma levels of levodopa result in more constant dopaminergic stimulation in the brain, leading to greater effects on the signs and symptoms of Parkinson's disease in patients as well as increased levodopa adverse effects, sometimes requiring a decrease in the dose of levodopa. Mechanism of action. The precise mechanism of action of Tolcapone is unknown, but it is believed to be related to its ability to inhibit COMT and alter the plasma pharmacokinetics of levodopa, resulting in an increase in plasma levodopa concentrations. The inhibition of COMT also causes a reduction in circulating 3-OMD as a result of decreased peripheral metabolism of levodopa. This may lead to an increased distribution of levodopa into the CNS through the reduction of its competitive substrate, 3-OMD, for transport mechanisms. Sustained levodopa concentrations presumably result in more consistent dopamic stimulation, resulting in greater reduction in the manifestations of Parkinsonian syndrome. Half-life: 2 to 3.5 hours. Dose: Parkinson disease. 100 mg, POQ8HR. May increase dose to 200 mg, Q8HR, but increased ALT occurred more frequently. Failure to show the expected incremental benefit on the 200 mg dose after a total of 3 weeks of treatment. Regardless of dose, Tolcapone should be discontinued. Always use as an adjunct to levodopa/carbidopa. Safety advice. Advice and warnings for the use of Tolcapone, Tasmar, during pregnancy. FDA pregnancy category C risk cannot be ruled out. That's all the information about Tolcapone we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.